Guys, if you're meeting me for the first time, this is Safaya Adeze. This program I talk about health and well-being, politics of great concern, and weekly declaration. Yeah, today I'm gonna be talking about colorectal cancer. What does that mean? Is cancer of the colon together with the rectum. That is where the name came from, colorectal cancer. This is colorectal cancer months, and I will not let it go by without addressing this situation. Yeah. Before we kick on, please, I implore you, my fans, like my program, press on the like button for me, subscribe so that whenever I post any video, you will be the first to receive it. Then give us the like button. If you have any topic of concern you want us to talk about, any topic of interest, yes, comment on the comment section and I will be there to address it. Yes. Also, connect me on Instagram, Facebook, TikTok, and my YouTube. Yeah, there. So we go on the yes. And how does this colorectal cancer? What are the things you might be looking out for? Yeah, some people go to the toilets and when they pass stool, they see blood in their stool. Blood in the stool is not a good sign, but some people will say, "Oh, I'm constipated." That might be the cause of the blood. Yeah, constipation can cause blood when you push out feces, a constipated feces, that's strong feces, forcefully. It might crack the walls of your rectal sphincter, and any of the tiny blood vessels might bleed, and then you find blood in the stool. Yeah, that can be, but a, that is not enough to keep silent. Some people go to the toilet and they use the toilet and they clean their bumble and they find out that there's blood in it. They say, "Oh, it's pie." Yeah, most times they say pie. Sometimes they call the one they call jetty jetty. They just take it and give it a name and wave it off. Now you need to see your doctor. Anything that causes you to bleed, do not assume that it could be pile, it could be jetty jetty, it could be constipation, it could be whatever. No, don't make your own diagnosis and don't make your own absorption. Go straight, see your GP or see your doctor, whatever you call it in your domain or in your district. See your doctor, let them carry out a check on you and confirm where this blood is coming from, because any blood from the canal is very important. So we're going to be talking about these signs today and how these things come about. Sometimes people might eat chili food and they'll say, "Oh, it's because of I ate food that has chili food." No. So colorectal cancer is referred to an abnormal growth. We can refer to it as malignancy. Abnormal growth, yes, arising from interior lining of the colon and go through the rectum, which is the last intestine. And it has the capacity to invade surrounding structures and even any tissues that are not distant from it. It does not just affect only the colon and the rectum, it can spread even to the, you know, to the liver, to the lungs, and it can even go to more distant places like the brain, the spine. Cancer that start from the colon can travel to the brain. Yeah. So that depends on how long it has stayed, will determine how far it can spread. So, yes. So we have some of the signs of this to look out for, especially when it has to do with colorectal cancer. So the signs that we can look at that can, you know, tell you specifically that is colorectal cancer is like when someone is having bleeding per rectum, that's bleeding from the anus. Don't assume that is pie. So we need to separate bleeding as a result of pie from cancer. Okay, not all blood that is due to jedi, not all blood that is due to pile. Mm? Because in pile, most time you see the blood bright red, but in colorectal cancer, it's not always bright red because it's coming from distance. Okay, so when you have colorectal cancer, the blood, apart from being mixed with the stool, the time they are defecating or after the stool has come out, colorectal cancer, there are other symptoms apart from being mixed with the stool. There are other symptoms such as weight loss. Sometimes you have feeling that you want to defecate, and when you get there, nothing comes out. And again, some people might find out that their stool has mucus. So that tells you that what you are dealing with is not just pile. And also there's changes in bowel habits. Okay, somebody who goes to a toilet every day may not be having period of constipation. Sometimes alternate it with diarrhea. Some people may just have passage of dark stool and tiredness, you know. So depending on the period. So yeah, pile may be a reason to pass a bloody stool, but it's um it's not a confirmation to say it is pile. Sometimes pile might even be there coexisting with colorectal cancer. So yeah, somebody can have pile and colorectal cancer at the same time. Yes. So there are two different conditions. Okay, there are two different conditions. I hope you're understanding my explanation. So please, the problem is that most people don't go to hospital on time. They usually wait. I know sometimes it's fear, sometimes lack of fund in some countries. But here, so maybe here in the diaspora, sometimes lack of fear. Some people lack of time. People don't create time for their health care. They keep working, they keep busy, especially when it's not really associated with pain. Anything that is not really associated with pain, they keep busy because pain is one thing that drives people to hospital. And colorectal cancer, it's not painful. It's only come out of it's only blood you see. So people keep postponing, and time. Yeah. So there are other symptoms. What I can so one time you go to toilet, you want to go, when you go there, you don't feel like you come out. And most people keep ignoring it. They keep ignoring. So it's only things that borders it's only things that limit their normal activity. People that before they start going to hospital, anything that does not limit people's normal activity, they don't take it serious to go to hospital. So there's also the factor of cultural belief. Some people may see it as spiritual attack or someone has poisoned them. Yeah. So, and this disease is not a disease of maybe old people, middle people. It's a disease of you see a variety of age. It's not for old people. It's not only for old people. You see old, middle age, young, even someone of at the age of 18 years. Yeah, younger people. So you see 20, 40. So it's common. It's not a disease of age people. It has been attributed to a number of factors: lifestyle, diet, and a contribution to the fact that people are beginning to, you know, um, start screening people more. So screening earlier now has been able to, you know, diagnose these things. Early screening, help early diagnosis. But when people don't show up, there will be no screening. Sometimes people come for other health condition while screening for some health condition, you now eventually find this in their system. So it's advisable that people should take their health very serious. You should take their health very, very serious. So, um, in the hospital, a lot of people may have colorectal cancer, but because there's no more screening, people, other people take it, the people believe that it's jedi jedi. They keep going about drinking the local herb, self-medication, and some other things, in a way to help themselves. So we're trying to, as much as possible, to discourage this kind of this kind of practice. Yes, it's not encouraging. It should not be encouraged. It's not advisable. So when anyone is in this kind of condition, you should seek the you know advice of a doctor. Go to your hospital, meet your doctor, explain your experience, note every signs and symptoms you're passing through. Yes, it's not village people, it's not community people. Everything is not village and community people. In fact, I will not even advise anybody to think of community people the first time you're having any illness. You should seek medical attention first. Yeah, I know we have religious belief, yes. While seeking medical attention, you can as well be praying. Yes, you can as well be praying. I'm a Christian by religion, and I believe my belief is different from your belief. Yes. So while you're seeking medical attention, nobody stops you not to pray. No, nobody stops you not to pray. So most people, once you tell them you want to, some people, they are scared when they come to hospital, and you tell them you want to use this machine to check their colon. They don't come back, especially because of the area of the body to pass into their anus. Or so they go, they don't come back. They have special machine, which is they use it to do endoscopy. That machine, you use it, you put it, that endoscopy, you put it in their mouth, and it goes down. There's one they call the camera. The layman call it the camera. You pass it in, and it take picture of all the you know colon and down. You check. We have other machine that also check pancreas and other organs of the body, bile and the bile ducts, to get all those things to, yeah. So there are different machines for this examination. So I encourage people to please show up. Please. A stitch in time saves nine. Yeah, a stitch in time saves nine. So when people report to hospital early, the colonoscopy will be done. Then when it is screened, then treatment can be, you know, treatment can be started at that time. But when people come late, that is where the problem is. Okay, so I will still keep telling people, please, no matter how busy you are, I know the world is so busy. The world is so busy. No matter how busy you are, don't joke with your health. As we say, health is wealth. Yeah, health is wealth. So try as much as possible to look after yourself. It's not all about going to work. I'm very busy, I'm very this, I'm very this. And if you're not there, the world will go on. Yes, if you're not there, the world will go on. So create time for yourself. Show yourself some respect, some yes, some value. Value your life, value your health. So when you seek your doctor on time, solution will be found. Yes, please, please. When you go to the hospital, the doctor will tell you what to do. Okay? It's advisable that anybody above 40 years should start screening, doing colonoscopy screening. Don't wait. Don't wait until you have even bleeding in your stool. So start doing that screening. Okay, it's very helpful. It's sometimes some cancer can be generic, but once you're up to that age of 40, go for colonoscopy screening. Do it regularly. Then if you see blood in your stool, don't wait. Run to your doctor. Okay, it's very, very important. Please share this, and you can be saving a life, so that people don't think that stool in their anus is a pile, or is jedi jedi as they call it in Africa, or is a due to constipation. Some people start drinking water. Oh, I'm constipated. They start drinking water. Please seek the advice of a physician. Do not wait. Do not assume. Don't live on assumption. Please. Health, as I say, is wealth. So please, as I said earlier, please like this program, subscribe, press the like button, and help to share. Please, so it can go round and reach someone who might be in need of this health talk. Thank you. Have a lovely week ahead.